My name is Dr. Michael Orr, cataract specialist for Eye Surgeons of Indiana, and I'd like to welcome you to the Surgical Care Center. This facility is a state-of-the-art eye surgery center exclusively for our practice, Eye Surgeons of Indiana. The video footage that you're watching is an example of modern advanced cataract surgery. Let me first give you a little background about me and about eye surgeons. I began to practice in 1984 and soon specialized in cataract, implant, and refractive surgery. I founded Eye Surgeons of Indiana in 1989 with the vision of providing the most advanced surgical and medical eye care available. The Surgical Care Center is an important part of this vision. Our single focus here is to provide cataract and glaucoma surgery that allows us to deliver the best, most advanced eye care in a very patient-friendly, comfortable, and compassionate environment. And it really makes a difference in outcomes and patient results. I have performed over 10,000 cataract implant procedures over the last 20 years. And this may seem like a large number, but the important part of that number is that the majority of those surgeries have been done right here at the Surgical Care Center. So I'm dealing and I'm working, and I have the privilege of working with the same nurses, technicians, and anesthesiologists over the last 10 years. This is a distinct patient advantage. For example, occasionally I'm required to go to a hospital to operate. It's not uncommon that I might have to operate with a staff that has no experience or little experience in eye care. And as a result, it allows for a less than optimal patient experience, but honestly, it really isn't comfortable from a surgeon standpoint. Here, this is our home court, and as a result, we provide comfortable care, but the surgeons are also relaxed, have excellent anesthesia and nursing staff to allow us to focus exactly on what you're seeing right now. It's also important for the patient to be comfortable. During this procedure that you're watching, your friend or loved one or family member is completely relaxed and sedated. They are blissful almost while I'm performing the procedure, and I think you'll find them to be quite comfortable and pleased afterward. That's because of the close working relationship I have with anesthesia and nursing staff to provide that kind of care during the procedure. As you watch the procedure now, you're watching a procedure called phacoemulsification. I began doing this in 1984, and this breaks up the cataract into a very small fragment, allowing it to be evacuated safely through an incision that is 2.65 millimeters, or roughly about the diameter of a ballpoint pen. So the instrument that I'm using is roughly the size of a ballpoint pen cartridge, and I'm evacuating the center part of a cataract. Well, what is a cataract? A cataract is not a skim or film over the front of the eye. You can see that I'm actually working in the interior of the eye, and that is just behind the colored part of the iris, so it's the front 1/3. I now am removing the residual or the soft part of the cataract, and this is just done with vacuum, taking out the cloudy area, leaving behind a very important structure called the posterior capsule, and this will allow for safe placement of the implant. I want to talk about one other advancement. In 1993, I began to use a topical anesthesia approach. In other words, without getting a shot behind the eye, I was able to numb the eye with drops and also medicine in the eye to allow for pleasant, painless surgery. This allows your friend or family member to leave today without a patch, without pain, and they're able to bend over, lift, go to lunch, go for a walk later. Basically, they can do almost anything they want today with the exception of driving. I would prefer that we see them tomorrow by myself or one of my associates so that I can ensure that they meet the requirements for driving safely. At this point, you're seeing the implant delivered into the eye through a very small incision. This implant hopefully will correct vision in excellent fashion. We have measured and for this implant preoperatively to allow for optimal visual recovery and visual result. I appreciate the opportunity to discuss with you this modern approach to cataract surgery. My nursing staff will be in to discuss any questions and follow-up appointments with you. Thank you very much.